final lecture for Farm for this semester. It's probably the shortest one I've ever done. Not going to cover much on the sexual. We covered in the regular Farm class enough on the male things. I think you're going to be covering the not the menopause, but like birth control and things like that will be in the family nursing course. So just going to touch on your hormone replacement therapy. Pearson, page 1469, has a whole table on it. Karch has a table in chapter 40, table 40.1. Conjugated estrogen, Premarin. It replaces the low levels of the estrogen. It is contraindicated if they have any history of clotting disorder or they've had an embolus, DVT, deep vein thrombosis, any breast cancer, any estrogen-dependent cancer, any pregnancy, and it's contraindicated for long-term use. You want to teach them to report any calf tenderness, chest pain, or dyspnea, which are obviously signs of a clot and emboli. Do not use with progesterone in patients with a uterus due to CA cancer risk increase. It's what we refer to as unopposed estrogen. So if they don't, unopposed estrogen, do not use, yeah. So if they, I don't know how else to say that. Okay, they also, your estrogen replacements can be given orally, transdermally, or vaginally, depending on what it's needed for, because sometimes the postmenopausal symptoms are just a significant vaginal dryness and tearing, or the transdermal, so they don't have to take an oral dose all the time. But any estrogen will increase the risk of cancer, so the patient needs to be aware of it, know to have all their screenings done and watching for any clots. There's herbs and different things that have been used. There's some people it works, some people it doesn't. There's multiple things out there. There's other forms of hormone replacements such as bioidentical hormones. You'll see some in certain pharmacists will do it. Some doctors' offices will do it. They can implant them just under the skin periodically. There's multiple things out there, but for your purposes, just understanding the Premarin as a conjugated estrogen replacement be given in several different routes, including transdermal, and the risk that you're going to teach your patient about that. And that's all I want you to focus on for this one. And that's the end of your final lecture for Farm 2.